What might prevent members of the community from coming forward if they were experiencing intimate partner abuse?
Shame is a huge barrier. People feel that somehow they are to blame for their situation, that they've made bad choices, or that what they're doing is simply wrong and they're being punished for it. And that all ties up with the whole stigma and shame thing that a lot of gay men feel anyway. That, I would say, is more the case with older gay men, those who've grown up when homosexuality was a criminal offence, and that they still have the legacy of they shouldn't be doing it, it's wrong. And therefore, when they find themselves in violent and coercive relationships, they almost expect it. And in those cases, what we do see is that it's only when it gets what they think of as serious that they feel they've got to do something about it. So low-level physical violence, mental violence, I think happens a lot within those sort of relationships within the community. I think, as I say, for younger men, we do see more what I call economic violence, where it's just a power imbalance, and they are being exploited and often being forced to do things that they really don't want to do, but they're terrified of losing what support they think they're getting. And so to then bring that to us, there's always the fear that the story, they worry about confidentiality because the community is quite small and there's a lot of gossip and everything, and they think if it gets back to the abuser that it's going to make things worse. That's very much how they approach it. I think the other barrier affects all the people that we would ever find coming to us, if they do come to us, is that will they be taken seriously? Society is beginning to take male abuse of women seriously. I think there are still people who think that, guys can look after themselves, so is there really a problem? So it's, will their situation be regarded seriously is a concern.
Men in general don't tend to come and disclose their experiences. They tend to try and manage it by themselves or present at the gum clinic and just get their healthcare needs met and leave it at that. It's notoriously difficult for men to whether they're heterosexual or not, they just find it really difficult to talk about those sexual violence experiences. And research on our experience would be that a lot of men that are in same-sex relationships, it's like an extra stigma onto what they're already feeling if they admit that they are experiencing intimate partner violence. So it's really difficult to capture them.
So there's the stereotype, the stigma attached to being a gay man, trans, we'd see some patients come in for an STD check where they might have had intercourse with a male for the first time, and they're worried and they're embarrassed and they don't want to talk about it. So it's quite hard to delve into the relationship, fully. I suppose one of the barriers to disclosing is where they're minimising it, saying, they were intoxicated or there were drugs involved and they don't want family members to know. A family member not know that they're gay, you see, or that they're in a relationship in a same-sex relationship. Those are some of the main barriers there. Coming to hospital, is where they might have kids from a previous relationship and where they don't want any implication to their access to the children. And it's just, I suppose, the embarrassment from the couples we've seen, less than obviously that are out there. There seems to be an age gap. There's definitely one of the things when I was looking back on my referrals, there seems to be 10, 15 years between partners in some instances. In two of them, I remember it was the older male that was the perpetrator, that the other partner can hold control over the person, where they might out them to a family member, Those are some of the more coercive, controlling behaviours that we'd identify, that they might hold over them or that they might stop the access to children. And again, it's housing. Housing is a massive issue, and lack of it, and maybe financial as well, where maybe they're more reliant on the other partner. I suppose the issues are similar to the issues we'd see in male and female relationships as well, but there's that stigma. The embarrassment is more prominent, and there's the issue of accommodation, housing, and I suppose the barrier to us pushing it more is the lack of services and the barriers to accessing, things like that. I know I keep going back to a safe place, but I mean, if we're saying if a patient is coming to us and he's saying that they're unsafe to return home, and we've nothing other than pushing for homeless services or Simon Nightlight even for a bed, you know, it can be quite disheartening for ourselves and a patient. And it does put them off coming back looking for help at times, which is sad.
Very rarely spoken about due to many dynamics, which were wide varying apart from very few people are out. And if people are out, it's usually very young, cisgendered Cabra men, which is doubled by the complications of our average age of marriage is still 18. The vast majority of people who work with have a partner or are legally married, which can lead to other kind of complications. But it would be something that that we would be very aware of when it comes to a lot of sensitivity of people not wanting to overly focus on it because it damages the images of travellers, which I don't really care about because I think people need to be supported when they need supported. And then also the programs that are focusing on gender violence, a lot of times focus on traveller women, and people are very hesitant to push men back into that space when women have so very few places. We need to put into the framing of our general stats. So the life expectancy of travellers is 61. 50% of travellers die by the age of 38, which means for half of our population, 19 is middle-aged. And 1 in 10 pass by suicide. So there's a lot of issues there. What usually happens when someone's of age, usually there would be the self-exit, as we sometimes refer to, which happens quite often. And so unfortunately, people go to England, or people become overly involved either in education or just in employment. Or, which the vast majority of people do get married. There's the vast majority of people, men that we deal with, are married. They are to women and have children. So, like the most recent kid we engaged with was a man who was 22 and he had 3 children. And the services didn't know how to handle a 22 or 3 children. He's also a traveller, you know?
I suppose maybe the legal profession not seeing it as big an issue. They mightn't see it as as it being something that does happen. I'm not sure, but maybe a little bit of prejudice from the courts or from solicitors they might not find it as easy as a woman would to actually get legal representation for this. And I suppose for themselves, a reluctance on their own part to actually get the help because maybe they feel that, maybe they wouldn't be believed or that it might not be seen as an issue in male-to-male relationships. I think there might be some kind of reluctance to admit it because, the societal, of a man not being able to defend themselves just because they are a man, and that might just stop them from coming forward, Maybe in the guards as well, there might be a little bit of perception again that this isn't an issue and that they should be able to handle it themselves because they're both men and, or maybe they feel it's easier to leave that kind of relationship maybe. And maybe that's the only advice they'd give them is, why don't you just get out of it if there's a problem? But not realising that the same barriers exist for them as in a male and female relationship, like fear of an escalation of violence if they attempt to leave, and lack of anywhere to go if they were to leave, a lack of services for them, lack of money. It all depends on their own individual circumstances in terms of financially, can they do it? Have they a safe space to go? Of all those barriers that exist for women would exist for them too, I'd imagine. And as I said, I don't know where I'd go to get them help apart from yourselves. So I'm wondering, is there a lack of awareness for them too? Would they even know where to start in getting help? There's probably not a high percentage of people that do come forward and they know that. And that might just add to their reluctance, to come forward themselves.